Doctors Mahli Brindamour and Meili are glad to be home, back in their familiar routines, but they're also grateful for their recent experience. Meili and Brindamour took their 2 kids along for the 6-month trip to the southern African nation of Lesotho. The 2 doctors volunteered to join a team working with tuberculosis patients.
We had a moment in our lives where we were ready to go for more adventures and learn more. And we wanted to do something as a family, but also continue to contribute. And then while talking about this and thinking about this, we also realized that we wanted to learn more to bring back here.
Meili says he learned to improvise in difficult conditions.
So we drove into the mountains to meet them because they were coming 40 kilometers by horse through the mountains to get to their appointment. So we ended up doing the clinic visit on the side of a mountain with the patient still on horseback, and just figured that was the best way to reach him where he was.
Lesotho has the world's highest rates of tuberculosis. Meili hopes their trip helped make an impact on the people there. Tuberculosis is persisting in northern Saskatchewan for many of those same reasons: poverty, overcrowded housing, and inadequate nutritional food. Meili and Brindamour say that they learned a lot in Lesotho that can help patients here. For example, in Lesotho, there's a program to supply TB patients with an assistant to help them take their medicine. Patients are also given food baskets if needed.
TB is a disease of poverty, of injustice, people who have been forgotten by the world. And that is fixable, but it's not fixable just with doctors and nurses and drugs. But the lesson we learned there, we hope to bring back here and try to apply to the programs that we are working with here. Because even though the challenges come from different roots, they're still quite similar.
Brindamour and Meili say the only thing that will bring long-term success, whether it's in Africa or here in Saskatchewan, is to improve social and economic conditions. Jason Warwick, CBC News, Saskatoon.